Hi, my name is Connor Gant. I'm a physical therapist, and I've been specializing in treating patients who have had hip and knee replacements for the past 5 years since I've become a PT. Today, we're going to go over the complete checklist of all the items that you might want to have before you go into your hip or knee surgery and why it will help you. Now, I know that we're going to have a lot of different people looking at this video. Some will want to buy everything, some will want to save their money. So I'll go over what each thing is good for, and if you really need it, or if you can replace it with something you may already have at home. But first off, typically after hip and knee replacements, depending on your fitness level, how your outcome from the surgery is, and your doctor's protocol, you will probably be wanting something to help you walk. So AKA a walker, a cane, sometimes even crutches, but that's more rare in that case. Typically, a walker or a cane is the first thing you'll be using getting out of the surgery for at least the first few days to weeks leading up, depending on how your recovery is going. So what I have linked is 3 different standard walkers with 2 wheels in the front. I did not link the 4-wheeled walkers, typically because I don't generally like them for short-term use where people may have balance issues, which after hip or knee replacement will definitely be most people. So I would rather you go with the 2-wheeled option. Now, the first option is just the standard 2-wheeled walker, standard height, everything comes as normal. The next is bariatric in case you were in need of a wider walker. And the third option that I've listed in the description is the short person walker, which is if you're 5'2" or below, this may be a good option for you because some of these standard walkers may be too tall and will not be functional for you. Now, other things that you might want in case you will be looking to progress down from the walker to the cane is a cane with a tripod base, not the quad pod base. I'm not the biggest fan of the 4-prong ones because people can kick them and trip on them, and I don't really like that. But the tripod adds that extra little stability compared to the single prong, but also isn't going to be in your way or getting kicked by patients after the knee replacement surgery. The cane isn't always necessary, and if you feel pretty confident that you'll be able to go from the walker to nothing, then you don't need it at all. But it is an option, especially if you have a lot of stairs in your house that has 1 or no railings. The cane can be really helpful because it's hard to go up and down the stairs with just a walker. Now, next on our list coming up is something that you might not usually think of, but it will help you get in and out of bed. I have 2 different straps listed in the description that will be helpful for you. One is a rigid strap, so it has a loop at the end and then another loop at the other end, but in the middle, it's rigid. So it will help you when you're trying to pull your leg in or out of bed, be a little bit more stable versus the other strap that I have, which is the heel slide stretch strap, which we'll go over in a second, can also help you do that same thing, but it won't be quite as stable because it's not rigid in the middle. So if you're looking to save some money, I would definitely recommend getting at least one of these. Either can be used for the purpose of getting your leg in or out of bed. The heel slide strap that is not rigid though is a little bit easier to use when you're doing exercises specifically for after knee replacement to help you bend your knee. So we have heel straps, walkers and canes. Moving on from there, something that people don't usually think about is something called a raised toilet seat. Now, it doesn't necessarily have to be a commode. If you are in need of that, you can get one. But raised toilet seats literally just raise up the height of your standard toilet seat, so they are like an extender to the toilet seat. And a lot of them come with handles, which if you don't have vanities or grab bars or something to grab onto right next to your toilet, come in handy a lot. So these will help you get on and off toilet, which is something that is unfortunately a big deal for a lot of people after their surgeries. So after that, we also have shower chairs. Now, depending on your doctor's protocol, the bandage they used, you may or may not be showering for a few days to a few weeks sometimes after your surgery. But it is also always nice to have a shower chair available to you in case you feel like your balance isn't quite there yet and you aren't quite confident in yourself in getting in and out of the shower and showering yourself without falling. So having a shower chair is a great option to prevent that. Next, we have the ice machine. Now, these come in various forms, but what they do is basically you fill them with ice and water so that it circulates that cold water through a like a strap that goes around your hip or knee, ankle. It actually forms to whatever you want it to on your leg, and then continually circulates that so it stays cold for longer. A lot of my patients really like these, especially compared to standard ice packs. Some also do prefer the gel packs, which I will also link below, which is just a standard ice pack, but it's gel, so it's cold, but you'll have to freeze it every probably hour or so to get it cold again. It won't circulate through. But the ice machines I see have typically been preferred because patients can just lay down, relax, let the ice keep going for over an hour, and it won't exacerbate any kind of issues with that a normal ice pack would in terms of like skin irritation. So while they're doing that, they are also typically elevating their leg. I recommend elevating your leg a lot after your surgery, minimum of 3 times a day for 30 minutes each time, and up to 4 times for an hour each time, depending on how swollen your leg is. So this can be done with just a few pillows that you have around the house. If not, I also have an elevated leg pillow that is a little bit more designed to be comfortable and help you with elevating your leg more comfortably because it can be pretty annoying and aggravating if people are getting like stretch in their leg that they're not really used to for several hours. Something that people don't think about, especially after hip replacement, is being able to put on their shoes and socks. So I have something called sock horn and a shoe horn. The shoe horn is literally just a little rigid scalpel kind of thing that you put on the heel of your shoe to hold it open so you can slide your foot in. The sock horn is something that you slide your sock over and then have it down by your foot, hold with the rope, pull it so that you can slide the sock onto your foot without having to bend down. So aside from that, we also have a grabber. This is also probably more so for hip replacements, but plenty of people do have trouble reaching towards the floor or up into cabinets or other things, reaching for things after their hip or knee replacements. So this will help you pick things up, reach up to grab things. If you're just having trouble getting up, this can help too. The grabber is helpful for that. Not too many ways around this one. A lot of my patients have them. They're pretty inexpensive, so it's easy to go for if you think you'll possibly have to be picking something up off the floor at any point after your surgery. The last thing that I have listed is a Cubii. This is essentially like a mini bike that could go under your desk. You might have seen these before, right? Now, these aren't always necessary, right? Especially if you're in a ton of pain, I don't recommend them for everybody. But if you feel like you want to get a little bit more activity, if you want to get some more bending out of your knee, especially after knee replacements, these can be good to keep the blood flowing while you're sitting and less active generally through the day because you're still recovering from surgery. They're not quite the giant bike, but they will get your knee bending initiated so that you can build up that flexibility. So out of that list, a few of those things that I would say aren't 100% necessary that you could save money on. You could save money on the ice machine, right? As long as you have standard ice packs, they still work. This is just a better option, I would say. So the ice machine isn't 100% necessary. The elevation pillow isn't necessary, but can be a little bit more comfortable. So if you find yourself really uncomfortable while just propping your leg up, throw with your toes above your nose to elevate your leg on standard pillows, then you might want to give this a go. Now, the cane may or may not be necessary, as well as a walker, depending on what your doctor says immediately after surgery. But standard procedure is typically people will come out of surgery with a walker. Raised toilet seat, if you already have a high chair for your toilet and you have things you can prop your arms on, grab bars, the sink vanity in your bathroom, then you may not need that, right? And then for the straps, if you really want to save your money on a strap to help get your leg in and out of bed or to help you bend your knee, you can use a dog leash, a belt that you put around your waist. These are the kind of things that you can use to save you some money and still function after your surgery. Thanks for watching. Again, my name is Connor Ganzer. I'm the owner and founder of Retry Physical Therapy. We specialize in treating patients for their hip and knee replacements after surgery, also endurance and strength athletes and getting them back in the game. If you like this video, please comment below. If you have any questions, comment below, and please subscribe. Thank you.